Hello, my name is Dr. Crockett. I'm CEO of Spinal Kinetics. We're a medical company that does spinal ligament injury testing for doctors all across the country. Now, one of the things that gets asked is, when should I do a CRMA? When should I do a computerized radiographic mensuration analysis, which is an excessive motion test that helps you to determine the severity and location of the non-disc ligamentous injury? And my answer is, you're going to do that test right away. You're going to test, you want to know right away. In my private practice, I wanted to know right away how badly damaged the patient was so I can set them up for the best treatment approach to get the most optimal results for that patient. Remember, everything that this testing and everything that you're dealing with here has to do with getting better patient results. So you want to do the test right away. Now, I get a question sometimes of, should I test every patient? Well, the answer to that question is, if you believe the patient has a ligament injury, yes, you're going to test them. If you believe the patient has a bad white blood cell count, you're going to test for it, right? If you believe the patient has a bad ligament injury, then you're going to test for it. So yes, you're going to test. In my private practice for years, I tested every single patient because I believed that those patients had ligament injuries, and I knew that the only way that I could tell how badly damaged they were was by doing this type of testing. Now, some of you are going to have patients that are already mid-treatment. What do you do then? You still test. And you test. Your rationale for testing at that point is to further understand the level and significance of the patient's injuries so that you can continue to improve your treatment rationale, your treatment procedures to get the best outcome possible. Some of you are going to have cases where the patient's at the end of treatment. You're wondering, do you have rationale for treatment still? The answer is yes. Now, the reason why you would do it at that point is you want to know the significance of the ligament injury so you can better determine what future care needs the patient may have. Now, some patients are going to be, you have the idea of pain and inflammation is going to restrict intersegmental motion. Nothing could be really further from the truth. Pain and inflammation does not restrict it, but what it does do is it restricts the patient's ability to get in proper position. So if a patient cannot flex or they cannot extend, you can't test. So you have to get the patient so they can adequately flex or extend. In my office for 17 years, and I did testing on all patients for about the last 8 years of my private practice, I would say in 8 years, I had 2 or 3 patients that could not actually be tested right away. So it was a very small number, and you know them as soon as you see them. They just simply, they can't flex and they can't extend. So you have to do some treatment to handle that. But you're gonna treat those patients, and you're gonna test those patients right away. Now, 30% of your patients are gonna have what we call a grade 3 or the most severe level of non-disc ligament damage. The other percentage, the rest of your patients, are going to have usually abnormal findings. That's because we're testing an injured population. So both of these injuries can be quite severe, and both of them allow you to place the patient in the best treatment program that you can possibly deliver so that patient has the ability to have a full and complete recovery. If you have any questions, please call our office at 877-908-9729. Thank you.